In this video, we're going to talk about the different forms of artifact that you will find when you are recording EEG and how to eliminate them. The first thing that you want to do before you even begin to record for EEG, we want to go into our recording software. In this case, we are using BrainMaster. So we're going to go into our settings and we are going to verify that we have some filters on that are going to help filter out electrical noise, anything above 60 hertz. So in the United States, our electrical outlets put out electrical noise, so to speak, at 60 hertz and above. Anywhere else in the world, it is at 50 hertz. So what we want to do is we want to go into our settings. We want to go into our channels, and we want to verify that our notch filters are set up. Now, we're going to look down here and we see that our software notch filters are actually at 50 hertz. So we're going to go ahead and change it to 60 hertz. And then we're going to use settings and close. Once we've done that, we have the client ready to do the recording. So the first thing that we want to do as we're putting our gel into the caps, to be very careful when putting the gel in, especially in the front. We want to make sure that we are not connecting our sites together. So in the front of the cap, you have FP1 and FP2. And then directly behind that, we have our ground, and then we have FZ. Those two sites are very close together, so we want to be very careful not to have our gel connect those sites together. If we do, that is called an electrogel bridge. And that makes it very difficult to differentiate between the two sites. It actually forms one site or one signal between both. So we don't want to do that. We want to be very careful when putting the gel in. We also want to be very careful when we are checking our impedances after we have our cap filled, not to wiggle the sites around too much so that we connect them with the electrogel bridge that way. So once we have our notch filters on and we have all of our sites filled and our impedances are good, we're going to go ahead and we're going to start recording our EEG. Now, what we do is with recording, you'll do the eyes open and then eyes closed, or vice versa, whichever you choose to do first. It is good to give the client instruction on what we are looking for and how they can help give us the best possible clean recording. We say clean recording, meaning the least amount of artifact possible. So let's go ahead and define artifact. An artifact is a signal that is being recorded, but the signal is not being produced by the brain itself. It is some form of either movement, physiological, electrode, electrical, any artificial source that is causing the signal. So what we like to do is we like to educate the client, and we like to show them some of the different types of artifacts that are common, and then we tell them how they can eliminate them. So we go ahead and we start recording. Now I'm going to go through the different types of artifacts that are common to recording for EEG. The first one that is very common are movement artifacts. This includes eye blinks, lateral eye movement, hypoglossal movement, which is the tongue, leg tapping or shifting or fidgeting. We have EKG or cardiac artifact, which is simply the heartbeat being picked up by the electrode, which is close to some arteries, especially at T3, T4, or even T5 and T6. We also have electrode artifact, which we call electrode pop. And this can affect one or more of the electrodes. We also have drowsiness. Drowsiness is more physiological, and this takes vigilance on the part of the technician when recording the EEG to be very vigilant of the EEG, to notice and become familiar with the different types of stages of sleep. So for drowsiness, we do have several different types of signs that we can see that the client is getting drowsy. We notice rhythmic top-notch theta, which I have been explained in the past that it looks like a Bart Simpson head. So that's pretty easy to recognize. We also have frontal theta and or alpha, which follows with a change of definition in the EEG, and then a drop of posterior alpha. You also will lose definition, and the alpha either flattens out or gets very small. You will also notice sleep spindles with K-complex waves. We also have EMG, which is simply muscle tension. These are very common in the frontal and frontal temporal areas of the eyes and the temples, and above the jaws. We have covered electrogel bridging, and we covered the electrical issues that we have with filterings. So let's go ahead and see some examples of what you're going to see. We have an example of an eye blink. These are very common, and we can see FP1 and FP2. And we have the EEG going along as normal, and we have an eye blink, which clearly affects not just FP1 and 2, but the temple area and the frontal temple area. So we have these eye blinks. They look like very large, exaggerated snow cones or ice cream cones. So we really want to try to eliminate those as much as possible. We also have lateral eye movement. This is an example of lateral eye movements, which you can see are much different. We have this showing an F7, F8. So lateral eye movements are the eye movements that are moving side to side, generally are seen in an eyes closed recording, and sometimes that is a sign that someone is starting to get sleepy or drowsy. Their eyes are becoming unfocused and they're not able to stay together. So you'll see different movements. It almost looks like phase reversal, but it's not. This is lateral eye movement showing at F7 and F8. We also have an example of eye and jaw tension. So you can clearly see the differences of EEG. We have normal EEG here, and then we look up and we look at FP1 and FP2, and we see a much bigger and thicker wave affecting FP1 and FP2, also FP3 and FP4. So this is very tense. This tension is moving all the way from above their eyes, all the way up their forehead, all the way onto the top of their head. We also have at F7, F8, we have tension in the temple areas. And we have tension at T3 and T4. So this is an example of all the tensions, except for O1 and O2. So if you are seeing tension at O1 and O2, more than likely that is coming from the shoulders or the neck, or the neck. So this is an example of tension in both the jaws and the front. We also have an example of an electrode. We talked about earlier, an electrode pop. This is very easy to see. F7 is going along just fine, and then all of a sudden it loses signal. This might look a little bit familiar to you when you are actually getting your impedances at the beginning before you record. If you have high impedances at different areas, this might look familiar to you because you do not have good signal. So when you see this, you want to pause the recording and you want to check. You might have lost signal. It could be a loose electrode. So these are easy to remediate as well. And then my last example is going to be of a K-complex wave with a sleep spindle. So this is something that you can look for in a recording, and this is going to show something. This is going to show some drowsiness. This is a particular wave. It's called the K-complex wave. And it's almost always followed by a sleep spindle, or it can be vice versa. You can have spindles and then the K-complex. A spindle, as you're seeing a regular EEG wave go across the screen, all of a sudden you see it's almost like squiggles. Like if you've ever seen on a lie detector, sometimes the needle will just start going and it squiggles across the page. This is what a sleep spindle looks like. So those are some examples of what you can see during the recording. Now we're going to talk about how to either minimize or eliminate some of these artifacts that we do not want in our recording. So we've gone over the electrical part. We want to make sure that our notch filters are on. And to eliminate any electrogel bridging, we want to be very careful not to overfill or move the electrodes on the cap around too much, especially in the front, so that we do not create a bridge. When you do start the recording, it is very important to visually inspect the EEG to make sure that there has not been an electrogel bridge. What you're looking for is to make sure that each wave has its own definition. So when an electrogel bridge happens, it combines the two sites in one. So if you are concerned or if you suspect that you have caused an electrogel bridge, what you can do is just visually inspect and look at the sites that you're concerned about. If they all look the same, then more than likely there's a bridge. And the best thing to do is to go ahead and take the cap off. The person will have to dry their head. We want all the gel gone and dried, and then you can try again. Being more careful next time not to overfill or to move the electrodes around too much. For the movements, these are the things that we can educate the clients on. And what you would like to do is to, before recording, show them what they look like and how they can eliminate, if at all possible, these artifacts. So you want to show them they can make a very tight face and then release it, and they can see the tension around the eye area, the temple area. They can clench their jaws, and they can see the tension at T3 and T4, and sometimes T5 and T6. You can show them sometimes if they are tapping their leg, which a lot of people do, you can have them do that, and you can show them that. A lot of times they are amazed at how different it makes the EEG that goes across the screen. So what we do is just educate them on that. That way they're aware. And then we have them get nice and relaxed and show them the EEG as we would like to see it. When it comes to EKG artifact, the only real thing that you can do is make sure that your ear references are filled, that the electrodes are filled totally, eliminating any holes or bubbles in the ear clips or even in the cap. For the electrode artifact or electrode popping, you just want to check your impedances as the recording is happening. If you see any of your impedances become high, go ahead and pause the recording and bring your impedances back down to the acceptable level. For drowsiness, most of the time, and not all the time, sometimes it does happen with eyes open too, you just want to be very vigilant of the recording as it's happening and visually inspect the EEG and look at some of the different types of the waves, what you normally will see. When you start to see the different waves starting to happen with your eyes closed, what is normal to see is the posterior area, the alpha will increase sometimes between 20 to 30%, and that is normal. What you're looking for is to see if there's any change in definition. When a person starts to get drowsy, frontal, sometimes lower alpha 1 will start to increase, and the posterior alpha will start to decrease. You'll start to see some of those sleep spindles that we talked about earlier, followed by the K complex. And you will start to see frontal theta that looks like the Bart Simpson head. So for drowsiness, sometimes you can give them a gentle reminder that will kind of wake them up a little bit, bring them back into focus. Sometimes you can make a little bit of noise, maybe turning on, like clicking and unclicking your pen, clearing your throat, moving something on the desk. That sometimes brings them back into focus. There are times where we have had to have people sit on something less comfortable than a chair, such as a stool. And that will help keep them awake and alert. So the reasons that we do not want these artifacts in our recording is some of these artifacts can mimic bands or frequencies. So for instance, eye movement. Eye movement is typically big. So this mimics delta, and a lot of times it will register as 0 to 3 hertz. EMG, for instance, jaw tension and eye tension can register as beta. When we are running the EEG through the databases, when we have these artifacts mixed in with normal EEG, the databases that we run them through do not know how to differentiate between the two. They are only programmed and told to look for particular frequencies and bands. And of course, it gets much more complicated than that when it comes to how the maps are produced. However, in the simplest of terms, it does not know how to differentiate between the two. So it takes everything that you give it, EMG, any type of artifacts, drowsiness, and it runs it and it makes a map. Now, when you do the recording, after the recording is done, you are able to what we call artifact the EEG. And that takes a skilled, trained person to go through and visually inspect and take out as much artifact as possible without making the rest of the good EEG useless. So given that, we do record between 8 to 10 minutes with eyes open and 8 to 10 minutes with eyes closed. That giving enough time for the person artifacting the EEG to have enough left over if there is any artifact to be taken out. Artifacting has been, there's a book called The Art of Artifacting, and there's some other publications out there, and almost all of them call it an art. And I do believe that is true. There are people that are very skilled and very trained and have a lot of experience in visualizing EEG and knowing what is good and what is not, what to leave and what to take out. But it is our job as the technician, when recording the EEG, to try and eliminate as much as possible and take all the steps that we need to, beginning even before the client is hooked up, to make sure all of our equipment is correct. As we hook the client up, to make sure that we have everything connected as possible, the best possible environment for the recording, and during the recording to do our very best to visualize the EEG and to minimize or eliminate as much artifact as possible. So this is what we are talking about with artifact. And as you continue on in your journey in neurofeedback, you will encounter different types of artifacts than what I spoke of today. These are the common artifacts that you will find and experience more often.